This year, COVID-19 has made it impossible for us to go ahead with a clinical trial of a new solution for chronic pain as we had planned, but it's kind of been a silver lining as well, because it's forced us into a position where we had to decide to run it remotely. And the good news about that is that it means that instead of just having a limited number of people in the trial from a very limited geographic area, we are now able to open up the trial to everyone who might benefit from it. So let's dive straight in and look at who this trial might be suitable for, because I need to make it clear that not all kinds of chronic pain are suitable. There are some types of chronic pain that are defined as chronic, but which have a clear explanation and are acute in nature, and we're not able to help those people. For the trial to be suitable, the pain must be non-malignant, which means that it's not caused by tumour or by cancer. The pain needs to have lasted for longer than expected, certainly more than 3 months, and I know some people have suffered for many years. So it needs to be a type of chronic pain for which there's no easy explanation. So we're not talking endometriosis or a pinched nerve, for example, because although those are defined as chronic pain, the cause of the pain is acute in nature. The types of pain we are talking about are back pain, for example, from degenerated discs or degenerated vertebrae. And the reason why I'm including that is because there are so many people walking around with exactly that type of damage who don't have any pain at all. So that type of pain, that type of damage, doesn't explain the pain. Likewise, neck pain, shoulder pain, post-surgical pain, post-injury pain, and phantom pain. Those are all types of pain that would be eminently suitable for this trial. Now, the good news is, in case you're wondering, some 95-96% of chronic pain cases are in that group. So the chances are that if you're listening to this and you have chronic pain, most likely you would be an eligible participant for the program. Now, because this is an entirely new approach to treating chronic pain, it's highly unlikely that you've come across anything like it before. But we want to reassure you that we have run 4 previous trials on SDR therapy. 2 of those have been on chronic pain. We're very optimistic about the outcomes for participants because of the track record of those 2 trials. They achieved 85% and 100% effectiveness, respectively. They were tiny trials. We know that the results are probably exaggerated, but nevertheless, we remain highly positive about the results that we expect to get from this much larger trial. So, what is SDR therapy and how does it work to treat chronic pain? SDR therapy is based on the very well-researched theory that chronic pain and acute pain are 2 very, very different things. In fact, when we look at brain activity for chronic pain and brain activity for acute pain, we see that they even look very different there. In chronic pain, it's the brain itself that is triggering the pain signals, rather than the pain being generated from an injury site, for example. Many other researchers agree with us that chronic pain is not due to the original problem. Chronic pain occurs because the brain has learned or has been conditioned to actually produce real agonizing pain signals. And these signals have nothing to do with your attitude or your thoughts, as you might have been told. It's simply a quirk of the remarkable human brain. So let's be clear, we're talking about conditioned responses, exactly as Pavlov demonstrated over 100 years ago with his experiments on dogs and other animals, and exactly as behavioural scientists continue to explore today. Now, it's remarkably easy to eliminate a conditioned response in a dog or other animal, especially working under laboratory conditions. But we humans are nothing like that. For reasons I won't go into right here, very good reasons, human beings don't respond like dogs and other animals when it comes to conditioned responses. And up till now, there hasn't been any reliable way to eliminate conditioned responses in humans. And that's not for want of trying. We've tried all kinds of psychological techniques, like a whole variety of cognitive behaviour therapies, exposure therapy, mindfulness, and many, many others. Without exception, they have all been inadequate. When it comes to chronic pain, we've also tried lots of different kinds of medications and lots of physiotherapy programs, and they've been likewise inadequate. In fact, experts universally agree that there is no current treatment which relieves chronic pain for the majority of sufferers. It's a pretty dire situation. So how is it that SDR therapy is able to extinguish these conditioned responses? How is it that SDR therapy can actually eliminate chronic pain? Well, let's have a look at the actual mechanism of a conditioned response, and I believe that it will be immediately clear to you too. First, there's always a trigger, and your brain responds to that trigger with a pain signal. The arrow in this diagram represents something that scientists call the reconsolidation phase of the conditioned response. This is where the conditioned response actually recreates itself, because that response isn't actually stored anywhere in your brain. It has to recreate itself anew every single time. The pain sufferer will never be consciously aware of this reconsolidation phase because it happens so fast. But scientists have demonstrated that if we disrupt this reconsolidation phase, we don't just stop the response then and there, we eliminate that response permanently. SDR stands for sensory disruption of the reconsolidation phase. So I hope that this has given you hope that conditioned responses, including chronic pain signals, are not the tough guys that we once thought they were, and that if we mess with the reconsolidation phase precisely enough, we can eliminate that chronic pain permanently, no matter how long you've suffered or how severe the pain has been. Mess with the reconsolidation phase precisely enough and you will eliminate or weaken the pain signal. Our expectation is that immediately following the trial, psychologists and other allied health professionals will be able to offer the SDR therapy program to those people who most desperately need it. So please consider playing your part in this and go to the download page to get the rest of the information, including the referral form which you will need to give to your doctor to refer you to the program, and we hope to see you on the trial. Good luck, and may you be pain-free.